وحدة أمراض التخاطب والبلع. تقديم تعريفي عن وحدة أمراض التخاطب والبلع بمستشفى الملك عبد العزيز الجامعي، من خلال هذا التعريف الذي يقدمه الدكتور محمد فرحات إبراهيم، استشاري طب التخاطب والصوت والبلع، المشرف على عيادات البلع بمستشفى الملك عبد العزيز الجامعي.
Communication and Swallowing Disorder Unit, CSDU, had the honor of working under the umbrella of the Department of A&T since 1978-1398, and finds from the department and its distinguished board all the support and backing, and still aspires more. By the grace of God and then the cooperation of all employees, CSDU continues its constant quest for excellence, which started many years ago in order to achieve its goals and objectives of the department and university. CSDU is located in Building 5, which is together with Building 1 constitute the King Abdulaziz University hospitals that belong to Faculty of Medicine, King Saud University. Our patients. It should be noted here the special nature of the patients asking for consultation at CSDU. These patients are only covered in few centers in the kingdom. The new cases often require a full hour for examination and evaluation, and therapy needs 20 to 30 minutes each session, except some cases suffering from hyperactivity with poor concentration, and some are suffering from delay in the mentality, and of course cochlear implantation rehabilitation, which require more time to assess and treat these cases. This is the reception of our unit. What about the CSDU staff? CSDU includes a number of eminent in the areas of phoniatrics and speech-language pathology. It includes 4 MED phoniatricians, 6 speech-language pathologists, 1 psychologist, 1 secretary, and 2 nurses. And still, we need more. CSDU in the organization of specialized clinics, which was adopted by the department, includes specialized clinics as follows: general clinics for language and speech disorders, stuttering clinics, voice clinics, swallowing clinics either in King Abdulaziz University Hospital or King Khalid University Hospital, open nasality clinics, and cochlear implantation clinics include pre-implantation clinics, new cases clinics, and rehabilitation clinics. CSDU contains the latest equipment in the field of assessment and management of communication and swallowing disorders, including 3 video laryngostroboscopic systems, 2 fiber optic endoscopic examination of swallowing, which is called FEES, 3 acoustic analysis, 2 open nasality machines, and other advanced machines. CSDU successfully holds Tuesday lecture program that's held weekly at King Abdulaziz University, and for the 4th consecutive year. This is the only weekly scientific meeting in the kingdom in this field. The number of attendance has increased significantly by more than 26 attendance per lecture, and still increasing. Each participant receives 1 credit hour by the Saudi Commission for Health Specialists for each lecture attended, and the total not to exceed 30 hours in 3 years. This is the Tuesday activity for the new academic year, 1430 and 1431. CSDU provides detailed lecture for a course of communication and swallowing disorders in each cycle of student of medicine during the academic year. It is given to the students of the 4th year of medical school. As well, CSDU produces several lectures to doctors during the fellowship program of study for some of topics that ENT doctors need as voice and swallowing disorders. Students from the Faculty of Applied Medical Science receive training in the unit in the specialty of language and speech disorders during their internship period. What about statistics? These bar charts show the difference between the numbers of patients attended at CSDU from 1425 and 1429, showing 1425 is in blue and 1429 is in red, showing increasing number from 4,401 patients in 1425 to 5,515 patients in 1429, putting in mind that our patient needs special care and special assessment. We used to have annual questionnaire to evaluate all the services in the unit to be distributed and analyzed so as to take picture of the problem experienced by the patients and their families, as well as the proposal through which the unit seeks to develop its services and provide distinctive medical services. This year, we are conducting 2 questionnaires. This is the results of one of our questionnaire conducted on 1428. About the residents, about 60% of our patients coming from Riyadh city and the rest is outside Riyadh. About half of the patients are referred from ENT clinic and 20% of the patients from pediatric clinic. 50% of our patients less than 7 years old as regards the age of our patients. This is the questionnaire items we asked about. It was ranked from very good to, excellent, fair to good, poor, and no answer. This is the items of our questionnaire. Reception, behavior, male waiting area, female waiting area, therapy sessions, counseling from the therapist, instruction in the brochures, session durations, communication between person and the therapist, clarity of the cause and treatment of the illness, family support, benefits from the sessions, feeling better with sessions. We are happy to have many very good to excellent answers, but still we have poor areas, so we are improving ourselves. CSDU at King Abdulaziz University Hospital had recently received praising from Professor Dr. Paul Kerr, the visiting professor and head of ENT and Head and Neck Surgery Department at the University of Manitoba, Canada, who visited the Department of ENT, King Abdulaziz University in Riyadh recently as an external examiner in the final exams of the King Saud University Fellowship of ENT. He also reported that CSDU that belongs to ENT Department Faculty of Medicine, King Saud University, is superior to many similar programs in the most prestigious Canadian universities. In this concern, we had the honor by receiving a letter from His Excellency Rector of King Saud University, Professor Abdullah Al-Uthman, emphasizing that this appreciation letter reflects the high level of medical services we reached in our country with the support of our wise leadership. The future. Actually, there is no limit to our ambition, but this great ambition needs requirements. Some of them may be substantial. They include recruiting more speech-language pathologists in the unit to cover the increasing need for health services, transferring the unit to an international specialized center, exploring the magnitude of communication and swallowing disorders in the kingdom, activating the scientific research, codification of more Arabic translated tests and training programs, creation of a developed database program for the patients, and discussing the need to initiate a program of communication and swallowing disorders being a specialized subspecialty of ORL course, as well as a master program for the speech language pathologist with the coordination of Faculty of Applied Medical Science. Thank you.